Hello, and welcome to another live broadcast with MedStar Health. My name is Karen Zengel, and I'm joined today by Dr. Angela Thomas and Dr. Matthew Beal. Today, we're going to discuss the new DC Safe Babies, Safe Moms program. This program provides services to care for moms and their families throughout their pregnancy journey. It is a partnership between the James and Alice Clark Foundation, MedStar Health, Community of Hope, and Mama Toto Village. So if you'd like to learn more about the services offered through the program and how you can get involved, stick around, share this broadcast with your friends, and please ask your questions for Drs. Beal and Thomas in the comments below. Dr. Beal, Dr. Thomas, welcome. Thank you for both for joining us today. We really appreciate it. Before we begin our discussion, will you tell our viewers a little bit about yourself and the importance of the DC Safe Babies, Safe Moms program? We'll start with Dr. Thomas.
Hi, thanks for having me, Karen. Appreciate having this conversation with you, and especially with my colleague, Dr. Beal. So my name is Dr. Angela Thomas. I am the Vice President for Healthcare Delivery Research with MedStar Health, but I'm also the executive lead of the Safe Baby, Safe Mom initiative. And as you've done a wonderful job of highlighting what that is, essentially we are a initiative focused in Washington, D.C. at mothers who deliver babies at our MedStar Washington Hospital Center. And to know a little bit about health in the maternal space, there is what's called a disparity in maternal and infant outcomes, where Black women have more unfavorable outcomes in the maternal and infant space than do their white counterparts. And so we want to reduce that disparity. And so we've put together a whole suite of services, some of which are performed or delivered by Dr. Biel and his team, and he'll talk more about that. But it brings together our women and infant services, our community pediatrics area, our family medicine, child and adolescent psychiatry, but also a lot of our community partners, two key community partners, our Community of Hope and Mama Toto Village. And so it's an integrated care delivery model because we understand that families and birthing individuals don't access care in a vacuum just in the healthcare system, but also the community. Their health is influenced by a number of factors: nutrition, housing, access, and so much more. And so we work together as a team in a life course kind of perspective. It doesn't end just with the delivery of a baby, but we want to make sure that child also has great outcomes. Up to age 3 is where we focus. But again, Dr. Bill can talk a lot more about that. So we're excited. It's a 5-year initiative, and any of our families that our providers care for who fit those age parameters, they are part of our Safe Baby, Safe Moms initiative. And so we're super grateful to the Clark Foundation to do such important work.
Thank you. Dr. Beal, want to introduce yourself?
Sure. Thanks, Karen. I'm Matt Beal. I'm a child and adolescent and family psychiatrist. Great to be here with Dr. Thomas and with you, Karen. And as Angela said, we're really in a position of great excitement and privilege to have a chance to address health of families and young children in DC from the beginning. A lot of the work that Angela and I both care so much about, it really takes a holistic and, as Angela said, a life course perspective on health. We know that health across the lifespan, both physical health and mental health, really begins at the very beginning. And the experiences that women have during pregnancy, experiences and health outcomes around delivery, and then the first years of a child's life are extraordinarily important in determining the health of that child over the entire course of their life. To an astonishing extent, that the start that kids get off to has so much to do with how things are going to go for them in their lives. And so what this project does is really take very seriously the opportunity that we have within the healthcare system to help families experience healthcare in a way that is responsive to their needs, and that is holistic, takes into account the entire person, the entire family, and the entire situation in which family is getting started. And then uses everything at our disposal within the healthcare system to really leverage our influence to get families off to the best possible start, to address all of the factors related to their health. And as Angela said, that's not just about a doctor's visit or a medication or a prescription or a lab test. It's about where families live. It's about the safety of their community. It's about the resources to healthy housing and healthy food. It's about the resources to equal employment opportunities. And then it's about the ways that the healthcare system treats people when they walk in the door. And we really see an opportunity here, we hope, to change the way that families experience care at MedStar, and that become a more family-centric, culturally responsive, and effective approach to ensuring not just short-term outcomes, but long-term lifespan outcomes. So it's a cool opportunity, and it's fun to have a chance to get together with you both today to talk about it.
Great, thank you so much. Yeah, I'm really looking forward to hearing more about the program. I know our viewers are feeling the same way. And so let's get into some more details about it. Let's start with Dr. Thomas. Can you tell us what is the overall goal of the DC Safe Babies, Safe Moms program?
Sure. So overall, long-term goal is to reduce maternal and infant mortality in the district. It is a 5-year initiative, and so we have some really key short-term outcomes that we want to focus on. So we know that some precursors, or there's some risk factors associated with mortality in both of those spaces, and so we focus on reducing rates of low birth weight for infants. So focusing on that, focusing on reducing severe maternal morbidity. And so that's when mom doesn't die, but something bad happens to mom. And so we want to reduce the number of cases. And there are a whole suite of other health indicators that could lead to something like that. So we focus on that as well. We also want to reduce the rates of readmission after delivery. We want to reduce the rates of what are called nulliparous cesarean rate. So that means the first time a mom has a baby that's a C-section, it's a risk factor for adverse maternal and infant outcomes. So we want to reduce that. And we want to reduce not just overall those outcomes, but we want to reduce the disparities between those outcomes. So we want to make sure all moms, all families, all babies have a level footing, and reduce some gaps that we see that seem to lean towards African-American mothers having more adverse outcomes for themselves and their children. And that, to do that work, there's a whole suite of services that we're excited that we can offer our families to help with that. And we look at things from at the very beginning, as Dr. Biel indicated, preconception, before mom ever gets pregnant, we have a suite of services that we provide all the way through age 3 for the child. So we're looking at preconception, prenatal, delivery, postpartum, and then that 0 to 3 time point. And some of the things that are consistent across all of those time points are screening for those social factors that influence health, also known as social determinants of health. We screen for those. We screen for behavioral health, substance abuse, mental health type needs, which Matt and his team does a wonderful job to help address. We screen for, we do care navigation, because navigating, even in my seat, I'm sure your seat, Karen, and Dr. Beal's, navigating the healthcare system is complex for us. And so can you imagine the complexity of navigating for 9 months plus, all the way up to that child is 3, navigating all of the different visits involved in that process. And if you need some extra care, or some specialty care, some extra visits, that becomes even more complex. So we want to make sure we provide the supports to our families that they need just to even access the system, and make sure they're getting the appointments that they need, the care that they need, the communication between their providers is there. All of those things are wrapped into our initiative.
Yeah, I would think, especially for the first time moms that they've never gone through it. I remember when I had my kids, it was just so many different appointments, and I went to this place for certain needs, and I went somewhere else for other needs. I mean, it's definitely very difficult. So that is wonderful to hear that this program can help just guide you and get you where you need to be, so you can stay healthy pre-pregnancy, throughout pregnancy, and then help you after the fact. Because there's always that question of, okay, now what? Now what do I do with this, with my family, now that I have this baby? So thank you for that background, Angela. Dr. Beal, why is this program so important, not just in DC, but nationally?
Yeah, for so many reasons, Karen. So I'll try to hit on a few. I mean, I think one, I guess the first way I come at it is, as I mentioned at the introductions, I'm a child psychiatrist, so I'm a kid person. That's the sort of like that's been what my career's really been about is addressing kids' mental health concerns. And the farther along I've gone, the more interested I've gotten in prevention and in moving upstream, and in realizing that as many of us know, if anybody who reads the paper knows, there's a local and a national crisis underway in kids' mental health.
Yeah.
The rates of crisis for not just adolescents, but even elementary school age and middle school age kids who are in mental health crisis, who are going to emergency rooms in crisis, who are experiencing suicidal thoughts, who are really having their development interrupted by really pressing mental health concerns. Those problems start much earlier than most of us realize. And we have an opportunity in healthcare and in public health to move upstream from the standpoint of kids' health and kids' mental health, to think about kids from the beginning. And kids who grow up in environments with adequate resources, with parents who are not so burdened by demands like poverty, demands like holding multiple jobs, demands like experiencing their own mental health problems that go unaddressed, demands like insecure housing. When parents are free from those overwhelming burdens, parents can parent the way that they hope to parent, the way they've always dreamed of parenting. And when parents can provide that environment for their kids, and I'm talking about from the beginning, like mental health does not suddenly begin when kids are 10 or 12 years old. The infants and toddlers and preschool age kids have emotional lives. And their brains are developing in a way that form the building blocks for their emotional and behavioral health for the rest of their lives. And if those kids are growing up in an environment where their parents have the bandwidth and the capacity and the resources to parent the way that they hope to, those kids thrive. And that's a way to be really doing mental health prevention over the lifespan. Conversely, when parents are parenting, when they're pregnant and then giving birth and then parenting young children, which we all know, Karen, I know you know too, how demanding it is to parent young children.
Yep.
If you're trying to parent young children and you're also dealing with housing insecurity, if you're also dealing with working 3 jobs to be able to pay the rent, if you're also dealing with legal issues that are hanging over your head, if you're dealing with perhaps unaddressed, untreated problems with addiction or your own depression or anxiety or post-traumatic symptoms, dealing with those things and trying to parent is extraordinarily challenging, and sometimes impacts kids' development in ways that it takes years to kind of come back from. And so the first thing that I think is so important about this project is by taking this life course approach to health and say, if we can create the best conditions for moms to deliver healthy babies and to start their journey as moms and as families from a position of health and well-being, that's good for everybody. That's a multi-generational win. So I think that's the first reason. Second reason is what's so great about this project, again, from the standpoint of a psychiatrist, is that we're talking about health services that don't separate mental health care out into some unseen black box over there. Oh, if you got a mental health problem, you got to go to that clinic across town. You got to go to that place that people go who are crazy or who are like, whose minds aren't right. That's not what mental health care is really about. What we know now so clearly is that mental health problems are extraordinarily common. Find me a family that somewhere in that family, somewhere across the journey of that family, hasn't had a challenge with mental health at some point, in a parent or a grandparent or a child. These problems are ubiquitous. They're everywhere. They're in all of us. They're in all of our families. They're going to come up at some point. It's part of being human.
Yep.
And so if our healthcare systems are to provide human-centric, humane healthcare, we need to have the capacity and the interest and the commitment to address mental health problems when they arise in every healthcare space. So that means at a prenatal visit, talking about prenatal and perinatal and postpartum depression, what it looks like, how to look out for it, what to do if those symptoms arise. It means in a pediatric visit, when parents are bringing in their child for a 2-month or a 4-month checkup with their new baby that they're in love with and also totally terrified of because they don't know what's going on, making sure that in the pediatric visit, someone's asking the parents how they're doing. How are they coping with stress? Are they getting enough sleep? do they have the support that they need to be the parents they want to be? Making sure that when a 2 or 3-year-old is coming in for a checkup, that we're checking on their vaccinations, we're checking on their motor development and on their language development. We're also checking on their emotional development. Are they able to handle difficult emotions? Do the parents have the skills to handle tantrums, to handle bedtime, to create family routines that generate sort of health and well-being across the entire family unit? That's got to be part of healthcare. And this project, Safe Baby, Safe Moms, takes very seriously that mandate that we need to be mental health savvy and mental health promoting and mental health intervening when necessary in every aspect of healthcare. And so that to me is thrilling. It's needed in DC, and of course, anything that happens in DC has this natural platform that's a national platform. For good or ill, we've got a lot of visibility. When things go well, a lot of people see it. When things go poorly, a lot of people see it. And we have the potential here to demonstrate with the project what it can look like when it goes well. When we create healthcare systems and experiences for families that really are going to prioritize, again, lifespan, life course, well-being, because we're thinking in this holistic and global way about health.
Thank you very much. That was a wonderful view into why this is so important. Let's talk a little bit about a family's experience, which we've touched on a little bit, and a lot of what you're saying, I'm going back to my own experiences, and I don't think anyone ever asked me how I was doing, and that would have been wonderful because it was not parenting, being a new mom was not easy it's not easy for anybody. You have no idea what you're doing. So the challenge and among everything that you've mentioned, it's just extremely difficult. And I think it's important to focus on both child and parents. So I want to talk a little bit about a family's experience. So once they enrolled in the program, so Angela, could you walk us through what that experience is like from enrollment through that age? You mentioned age 3 is the focus. Can you talk about that?
Yeah, of course. So enrollment for us actually means, are you being cared for by one of our providers? And if the answer to that question is yes, and you fit the age parameters, women of childbearing age or adolescents of childbearing age, and then up to 0 to 3 years of age, and you're being seen by Dr. Beal or his team, Dr. Laurel Patchen at Washington Hospital Center through Women and Infant Services and her team, Community of Hope, family medicine with Dr. Rowett and her team, or community pediatrics with Dr. Janine Rethy and her team, and you are automatically enrolled as a Safe Baby, Safe Moms family. So, and as mentioned, we have the 5 different time points. So this could mean that Karen, for example, you are seeing let's go with Dr. Rowett as a family medicine, your primary care visit, and you might screen for high blood pressure. She wants to get that under control in case you decide you want to increase your family size and want to make sure that if you do become pregnant, that you're okay in that space. So you will be enrolled because you're being cared for by Dr. Rowett in the preconception phase. And then you get followed along. Say you just carry your care throughout prenatal care and delivery and postpartum in 0 to 3. That's sort of the perfect model, if you would, of somebody entering at the beginning and going all the way through. But the world doesn't quite work that way. So we have moms and babies who come in and out. Some moms we won't see until she shows up at hospital center to deliver. And maybe we'll see that child postpartum all the way through age 3, but maybe not. But that mother, when she shows up to deliver at hospital center, she is part of Safe Baby, Safe Moms. There are children that Dr. Rethy would only see in the 0 to 3 time point because they are seeing her for pediatric care, and maybe the mom never receives her care by one of our providers, but that child will be a Safe Baby, Safe Moms child. And so if you are being seen by one of our providers, you are automatically enrolled. Recently, I had a conversation with somebody who asked that very question. I said, make an appointment with one of our providers, and there you have it. You're in. And so it is that simple.
Wonderful. So once you have that appointment, do you, how does a patient know that they are, other than you just telling me right now? Dr. Beal, do you have that conversation? Do you say you are a patient of mine and we're doing this program? What's the education that you're providing to those patients when they come to see you? Is there something that they receive, that they're part of the program, and how does that is there just kind of communications? I'm just trying to understand the experience and what you would expect after that. That you have that patient, you're enrolled in the program. What's next?
I think what we want it to feel like for patients is not like anything unusual is happening.
Okay.
What we want it to feel like for patients is this is how care goes at our centers. That if you're getting healthcare at our centers and you're contemplating becoming a parent, you're pregnant, or your partner's pregnant, or you've now got a new baby or a toddler or a preschooler, that this is just what care looks like. When you come to get care at one of our centers, we're gonna ask about every aspect of your health and well-being. We're gonna ask about housing. We're gonna ask about nutrition. We're gonna ask about legal needs. We're gonna ask about financial needs. We're gonna ask about social supports. We're gonna talk to you about mental and behavioral health, let you know why it's so important for you and for your child, and how we're going to keep track of it, and how we're going to look out for things, and how we're going to know when you're doing well as when you're struggling, because it's not just about ill health, it's also about indications that you're actually thriving, and how that promotes good health, and that's going to be part of your experience when you come in for care. If you know, well, I guess Karen, we're using you as our example. So if you were contemplating having another baby and you came in and you were identified with having high blood pressure, your primary care doctor would say, we're going to keep an eye on that because that's a really important part of your health if you decide to become pregnant again. And then you become pregnant. Now you're pregnant. Oh, good. The blood pressure is low. Let's talk to you about some other factors that are going to relate to your health during pregnancy as well. Let's monitor your glucose, because we want to look out for gestational diabetes. That's common. We're going to talk to you about depression and anxiety, because those are very common conditions during pregnancy. And here's how to know if that's going on for you. And let's use these screening tools. We're going to talk to you about social supports, let you know about programs that are going on in the clinic to connect pregnant women with one another, to provide peer support. We're going to talk to you about planning who's your pediatrician going to be, and what to expect when you go to pediatric care, when you go in for your first visit with your new baby. Again, we're going to ask about your health, your mental health, what your delivery experience was, what your goals are as a parent are, who are you going to count, who are your supports in your life? Are there grandparents and aunts and uncles and neighbors and partners who are going to help you to care for the child? Talk to you about what to expect about your child's development. It's not, being in Safe Baby Safe Moms isn't about being in some kind of an esoteric little program over here that we're sort of getting some information about. It's really like about the entire experience.
Right.
So being in the program means that you're getting care in a way that has this really holistic focus.
And it seems very personalized and focused, and you're getting a ton of resources and that guidance throughout. So the different team members are kind of working together to take you along that journey is what I'm hearing. So thank you for that. That really helps to really think about what to expect when you receive care through MedStar Health. And along with that, we have this wonderful program that will support you. So I know that there was some research involved with this program. Angela, can you tell us more about the research component of this?
Sure. So one of your earlier questions to Dr. Beal was why is this important nationally? So, and I believe in my introduction we talked about the national issue of maternal and infant mortality. And so because we really strongly believe, and there's evidence to support everything that we're doing in the initiative, but there's nothing that shows that when you put it all together, when you put all of these incredible resources and care delivery practices together, that it will move the needle. And so we want to make sure that we're informing the national conversation about proper care delivery in the perinatal space by having a research element that goes along the initiative. So this very much is a clinical initiative. It very much is clinical care, but we want to make sure we're providing evidence on why it's important, because there's a lot that we're doing that insurance doesn't pay for currently. And so that's why this grateful donation and investment by the Clark Foundation is important. But we don't want it to come at the end of the 5 years and have all these incredible services go away. We want to be able to show that these things are important, integrating mental health professionals with our midwives and obstetricians and family medicine physicians and pediatricians is super important for our health outcomes. And so we have a wonderful team of researchers, which includes implementation science, which is the science of understanding why things work when you try to implement a thing. Why did it work, or why didn't it work? What conditions will make that implementation successful? And what are some barriers and challenges in understanding those? And so we have that running alongside. We also have health economics, because we want to understand the cost of everything, the cost of delivering the services, the cost to our communities, to our families, understand the cost to the healthcare system, and so much more. So we want to understand that to be able to make the argument that, look, this is financially a good decision for everybody. We also have biostatistics and informatics. That's a very fancy way of saying it's a whole lot of numbers that we have to measure. And we have to measure to be able to say that what that change we saw, that wasn't just by chance. Like, that was a significant change. When we delivered this, it really made a significant difference in the lives of these families. And so we have a really strong statistics and informatics team behind this. And then in healthcare, we have what's called an electronic health record, where all the data about everybody and their care is in that. So our providers can always access information about our families. And so we extract important information from that so that we can measure and see what those outcomes are. It's in that electronic health record that we record how much did the baby weigh when the baby came out, or did Karen what was her high blood pressure? It's in that record that we record that. So it's important that there's a team that can extract that information. And then we leverage that same data source for what we call data science. So there are incredible things that a lot of smart people can do to help with this. So when Dr. Beal is seeing one of his children, when they screen for certain things, there's some things called clinical decision support that can pop up on the screen and help remind him of things that he said he would do, or the best thing to do for that particular patient. So we have clinical decision support embedded in that, which is using the power of research on how to really use data effectively to deliver really great care. And then one really incredibly important component is our health equity research, in that we've been talking about, Dr. Bill said it very wonderfully, that when our patients and our families, our moms, our children interact with the healthcare system, we want to make sure they're treated well. And we know historically there have been some challenges in that area for certain populations. And so we want to make sure we're culturally responsive. We deliver care with cultural humility as well. We want to make sure that everybody who interacts with us feels respected, has an experience without discrimination or bias. And so we have implicit bias training embedded throughout the initiative, not a one and done, but all of our staff undergoing constant implicit bias training to get at some of these elements of how a patient might feel mistreated as they interact with the healthcare system. So our goal is to reduce that, because those interactions themselves have health implications, not just in how the care that's been delivered, but also internally, stress, and which can lead to hypertension, which can lead to adverse outcomes, and much more. So those are the important research elements that we have going alongside. At the end of the day, we want to be able to say that this worked and this is why it worked and this is why others need to do what we've done in our program.
Thank you very much. So I know that the program is driven by the Strategic Advisory Board. Can you tell us what makes up the board and why forming the board was important? Is
Sure.
that part of the research or is it separate?
It's separate. So Safe Baby Safe Moms has an organizational structure, and Dr. Evans, he's the Chief Medical Officer of MedStar Health, oversees the entire initiative. And then the rest of the executive leadership team is Dr. Neil Weissman, who's our Chief Scientific Officer, and then me as executive lead. So I report to both Dr. Weissman and Dr. Evans. And then we have our clinician leads. That's the leadership team that Dr. Biel is part of as leading our child and adolescent psychiatry and mental health components of the initiative. But we also have clinician leads for pediatrics, family medicine, women and infant services. We have our research leads who lead those components that I just went through. And we have community leaders who make sure that we stay connected to the community, engage the community, make sure we're on track from a community perspective and doing the right thing for our families. That's the leadership team. Then there's a strategic advisory board. And the strategic advisory board consists of everybody on that leadership team, but also other key stakeholders who can provide guidance and advice on along the way. So are we doing the right thing? Is there something that we're missing? Is there something that we should be considering as we deliver the initiative? So some examples of who are on that board: we do have representatives from the DC Mayor's Office. We have representatives from DC Health, DC Healthcare Finance. We have representatives from Georgetown University, from GW University with the Rodham Institute, and many more. Just stakeholders who are either in the delivery of care in the same space in some way, shape, or form. Not Thrive by Five, No Kid Hungry, which is addresses food insecurity. So you got payers, you've got decision makers, you've got other professionals who share the same heart of tackling this important issue and have been doing this for years from a different approach. So a bunch of different perspectives, and that I would say is the ultimate goal of that advisory board, is to get a suite of perspectives, diversity of thought around this very complex yet very important topic, and help guide us along the way.
Wow, there is absolutely, I think I lost count of all the people that are involved. Clearly a very important program, and for many, many reasons, as you all mentioned, the why and the goals of the program, and a lot of people that are supporting it, from MedStar Health leadership to the community. I mean, really just a wonderful group of people who are helping to keep this program doing what it's doing best. So thank you for giving us that perspective. Before we wrap up our broadcast, I did want to just, I know we talked about this a little bit earlier about when it comes to the experience, and as soon as you have an appointment with, say, Dr. Beal, you are part of the program. Are there any other eligibility requirements that are involved to be part of the program outside of that, so people know how they can get involved? Or are there other ways that you can get involved even without actually, being a patient, perhaps?
Yeah, well, one way, if you have any questions, you just want to get involved, send us an email. It's probably the quickest way, at SBSM, which stands for Safe Baby Safe Moms, SBSM at medstar.net. That's probably the easiest way. If you I really just want to get involved, just reach out, and me or a member of the team will connect with you. Or if you're like, I like this Matt Beal guy, I want to see him, we can help guide you on how that can happen as well. There are other ways to get involved. I think doing this, I would say, Karen, you're involved in helping us spread the news. And there are
broadcast
in a broadcast,
yeah.
But also, just being a mouthpiece in your own space, in your own platforms, about the importance of seeking care, keeping mom safe, keeping baby safe. get educated, connect with folks like Dr. Beal or myself on ways that we try to keep women safe. Um, get connected to some of these organizations, these community organizations like No Kid Hungry, who are really trying to provide food resources. Volunteer with them. There are lots of peripheral ways that you can get connected to Safe Babies, Safe Moms by addressing some of the issues that we hope to address in our particular initiative. But again, best way is to contact us, sbsm@medstar.net, and we can kind of talk about what you're interested in and figure out how we can get you connected.
Wonderful. Thank you so much. Dr. Beal, anything to add to that as we wrap up the broadcast? Anything in general that you would like to, a takeaway for our viewers, perhaps?
I think you've led us there really beautifully, Karen. I mean, for anybody out there who's listening, whether you're a MedStar patient or not, this is what I hope patients start to demand from their healthcare. We need to change the way that we approach patient care in a way that is much more responsive to people's lives and people's needs. And so I hope that patients feel empowered to ask for what they need and to expect that, when women are pregnant, they're not just a vessel for a baby to come into the world. Their experiences and their own health, body, mind, and soul is going to be the biggest single influence on the start that their kids get to life. So we need to really take that seriously and walk the walk around that in healthcare. So go out there and push that message.
Thank you so much. I like this Matt Beal guy. Really wonderful message, and wonderful information on this program. I know I learned a lot. I'm thinking about my own health and my family's health and my experiences, and you really opened my eyes to that. And I hope other families felt the same way. And I just appreciate both of your time. We are going to include some additional ways to learn more. We have the web email address that you had mentioned, as well as a link to a page on our website so you can learn more. And as we mentioned, you can get involved by sharing this broadcast with your friends. We really would appreciate that to spread the word. And that's it for us for today. Thanks again to both of you for joining us. And thank you to our viewers who watched us today and participated. We really appreciate it. And we hope you have a wonderful, healthy rest of the day. And we will see you next time.
Thank you, Karen.
Thank you.